Imagine waking up every morning with your spine feeling like it's locked in place, struggling to bend, twist, or even sit comfortably. For many people with ankylosing spondylitis, this is a daily reality. The pain, stiffness, and inflammation can be relentless, making even the simplest tasks like tying your shoes or getting out of bed a challenge. It's not just about discomfort. Over time, the vertebrae in the spine can fuse together, turning flexibility into rigidity. Naturally, people look for relief, and one option some consider is chiropractic care. But the question is, can chiropractic adjustments really help manage or is there more to the story? What is ankylosing spondylitis? Ankylosing spondylitis is not just regular back pain. It's a form of arthritis that primarily affects the spine and sacroiliac joints, which connect the spine to the pelvis. Over time, inflammation causes pain, stiffness, and if left unmanaged can lead to the fusion of the spinal bones, making the spine rigid and less flexible. For some, may present mild, temporary flare UPS, but for others, it can be a chronic and progressively debilitating condition. The challenge? Finding ways to manage the symptoms, stay mobile, and minimize pain. Chiropractic adjustments, a possible path for relief? Chiropractic adjustments, or spinal manipulations, involve a chiropractor applying controlled force to a joint, sometimes with their hands, sometimes with a device. It's often considered for managing back pain and improving mobility. But is it right for people with ankylosing spondylitis? According to the National Center for Complementary and Integrative Health, NCHE, spinal manipulations can offer small improvements in chronic back pain, helping with everyday tasks like walking, standing, and sleeping. For someone with this might sound like a glimmer of hope. But there's more to it. What do the experts say about chiropractic care for Here's the reality check. The Spondylitis Association of America, SAA, and the Arthritis Foundation both urge caution. They advise against chiropractic care for people with active inflammation or fused vertebrae, as the adjustments could cause more harm than good. Think of it like this: trying to adjust fused bones is like trying to bend a stiff, rusted metal rod. It just doesn't work, and forcing it could lead to fractures or other serious complications. In fact, a 2017 research review emphasized that high-velocity, low-amplitude techniques, those rapid, forceful adjustments, are not recommended during the inflammatory phases of This is because the inflammation makes the joints more fragile and susceptible to injury. However, there's a silver lining: low-velocity, low-amplitude techniques, gentler approaches might be safer for some people. But even then, the risks need to be carefully weighed. The risks of chiropractic adjustments for The reality is, chiropractic care comes with risks, especially for people with Because can lower bone density, making the spine more brittle, there's a higher chance of fractures, particularly in the vertebrae, hips, or forearm. Neurological complications are also a concern, especially if the neck is involved, even if there's no active inflammation. Why? Manipulating the neck in someone with can lead to severe spine injuries, potentially resulting in paralysis. The takeaway: chiropractic care for isn't one size fits all, and in many cases, it may not be recommended at all. A look at the research: can chiropractic care help? It's easy to get drawn in by stories of people finding relief through chiropractic care. A 2017 case series looked at 3 individuals with inactive who experienced inflammation and stiffness for over 3 months. The results? Spinal manipulation and rehabilitation appeared to reduce symptoms and improve musculoskeletal function in these cases. But here's the catch: case studies like this offer only a glimpse. They don't apply to everyone with While chiropractic care might help in some cases, it's not a guaranteed solution and must be approached cautiously. Other therapies chiropractors can offer. Chiropractic care isn't just about spinal adjustments. Many chiropractors also provide additional therapies that may benefit people with especially when manipulation is not an option. Ultrasound therapy, using sound waves to create a massaging effect on soft tissues and joints, which can help reduce swelling and stiffness. Electrotherapy, Small, painless electric pulses stimulate nerves and muscles to treat soft tissue injuries. Cold laser therapy, a non-heat producing laser that penetrates deep into the tissue, potentially reducing inflammation. Infrared sauna, controlled heat that warms joints from the inside, helping to relieve pain and improve circulation. These therapies can be useful, but again, they're not miracle cures. They work best when combined with other treatments and under the guidance of a healthcare professional. Conventional and alternative treatments for AS. So, if chiropractic care is risky for AS, what are the other options? Conventional treatments are usually a safer bet. Medications, physical therapy, and sometimes surgery are standard approaches. Doctors may prescribe anti-inflammatory drugs, corticosteroid injections, or even biologics medications that target specific parts of the immune system to reduce inflammation. Some people may also benefit from Janus kinase, JAK, inhibitors, which block inflammation at a cellular level. Surgery is rarely recommended for AS, except in severe cases, as it carries risks of complications, like the formation of ectopic bone when tissue turns to bone in areas it shouldn't. But let's not forget about alternative therapies. Acupuncture, yoga therapy, massage, and TENS, transcutaneous electrical nerve stimulation, are other ways to manage pain and improve mobility. These treatments can be gentler on the body while providing relief, especially when used alongside conventional care. The power of exercise in managing AS. While medications and therapies can help, exercise is one of the most powerful tools for managing AS. Regular movement can help keep the spine flexible and reduce the risk of vertebrae fusing together. An ideal exercise program for AS should include range of motion and stretching, moving muscles and joints through their full range to improve flexibility and reduce stiffness. Aerobic or cardiovascular exercise, activities like walking or swimming that get your heart pumping, improving endurance and reducing fatigue. Strengthening exercises, especially targeting the core muscles, which support posture and make everyday movement easier. Balance exercises, these improve stability and reduce the risk of falls, particularly important for those with lower bone density. Water-based activities, swimming or aqua aerobics place less strain on joints while still offering a full-body workout. Conclusion, is chiropractic care right for people with AS? Chiropractic care for ankylosing spondylitis is a bit like walking a tightrope. On one side, some may experience relief, but on the other, there are significant risks, especially during flare-ups or in cases of spinal fusion. While chiropractic care might help reduce pain and improve function for some, it's not a go-to option for everyone with AS. Consulting with a doctor is crucial before considering any form of spinal manipulation. Ultimately, managing AS requires a combination of treatments, from medications and physical therapy to alternative therapies and exercise. While chiropractic adjustments might seem tempting, it's important to weigh the potential benefits against the risks. If you have AS, remember, the goal is to stay flexible, mobile, and pain-free, and there are many ways to achieve that without taking unnecessary risks.